Can COVID-19 infection increase the risk of eye diseases? This nationwide study investigates that question. This is the largest self-controlled case series study analyzing data from 52 million people in Korea. The study aimed to assess whether COVID-19 infection increases the risk of serious ocular adverse events. It focused on conditions such as retinal artery occlusion, retinal vein occlusion, uveitis, scleritis, optic neuritis, ischemic optic neuropathy, and ocular motor cranial nerve palsy. Previous studies lacked statistical power and suffered from bias, but this study overcomes those limitations. By using the SCCS method, individuals act as their own control, eliminating confounding by baseline characteristics. The post-infection risk period was set to 24 weeks and split into early, which is 1 to 8 weeks, and late, which is 9 to 24 weeks phases. The study used conditional Poisson regression and stratified the data by age, sex, income level, and comorbidities. The main finding was that COVID-19 infection did not increase the risk of any ocular adverse event in the general population. However, individuals with pre-existing cardiocerebrovascular disease showed a 19% increased risk of retinal artery occlusion in the late phase. This may be explained by COVID-19-induced inflammation, endothelial damage, and hypercoagulable states. The immune privilege of the eye may offer protection against systemic inflammatory responses, explaining the lack of other ocular involvement. Over 200,000 incident cases were identified and analyzed using comprehensive national insurance and infection data. Still, diagnoses were based on claims data, and long-term risks beyond 6 months couldn't be assessed. Compared to previous cohort studies with limited cases and confounding, this study provides strong, real-world evidence. These findings offer guidance for clinicians and health authorities on managing post-COVID ocular risks. For clinicians, it's worth monitoring retinal artery occlusion in patients with vascular disease history, but widespread alarm isn't needed. Future research should explore longer-term effects and consider newer COVID-19 variants. This study contributes valuable evidence to our understanding of COVID-19's impact on eye health. In conclusion, COVID-19 infection doesn't broadly increase ocular risk, but specific high-risk groups may need closer attention.